Hey, you guys, I'm really sorry that you're seeing the screen on that's pointing the back of my room where my lockers are. My camera's pointing the wrong way, and really what you need to see today is the BLS video. So I'll be recording some of the BLS video for you to watch to prepare for your BLS test and check off. So let's get started. It'll take it just a minute. I'm sorry for it to get loaded up, but then we will get started hopefully now.
Heart disease is the number one cause of death in the world, more than 17 million deaths per year.
Cardiovascular disease claim more lives than all forms of cancer combined.
Early recognition and CPR are crucial for survival from cardiac arrest.
With high-quality CPR, saves more lives.
American Heart Association. Products are shown for demonstration purposes only. The American Heart Association does not endorse or recommend any specific manufacturer or product. In order to I would say the first time I performed CPR, I felt like
Confused.
it was surreal. I wasn't sure if it was good enough, and if the patient didn't survive, I wasn't certain what it meant.
Suddenly, you stop talking about it. You get ready to take blood pressure and you just stop. Computer poisoning is probably almost like a coffee shop.
The medics called and they were bringing in a guy who was having an acute MI.
It sometimes can be a scary situation. Relax. The training skills are there for a reason. You know what to do.
It's such a so many times. It was more like in the moment and what to do. So I felt confident in my skills.
There's always that moment where you've got to step over your own shadow to let the training and fundamentals, what's most important, come through.
You never know when you're going to need to use it. And when you do, you don't want to have to stop and think about it.
Things are always changing. American Heart Association helps you stay on top of that. The American Heart Association training is really focused on providing you with the tools that are needed for resuscitation.
So learn the risk, listen to what the instructor said, and do it for one. And then be prepared that it's not going to cost us.
We always inform the always need to do what we're calling finding the human situation.
We coded and we ran the code, we did CPR, we chopped him and got him back.
And very quickly went back into a normal rhythm.
Just the look on his face and touching his family that I really remember.
It was a good day. Everybody threw a little high quality CPR. A couple of weeks later, we done more with highlights and right.
When you realize that this guy was completely, out and his heart wasn't beating, and you just brought him back. That is amazing. Those are just a few stories of providers who know the importance of what you're about to learn. Basic life support, or BLS.
On any given day and any time, you can encounter a victim of cardiac arrest. Because about every 90 seconds, a person dies of sudden cardiac arrest. And with the training you see today, your actions will give the victim the best chance to survive.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, the terms don't mean the same thing. Cardiac arrest occurs in both men and women, but for demonstration purposes in this course, we will perform CPR on adult male victims. Can I just talk to you today?
No, that's not going to work.
Done. Done. Are you okay? Done? Done. Help. Somebody help.
That person got cancer, you got to
Excuse me. I think there's a concussion. And the pulse, cellular pulse is not there, they start CPR. How long was you doing?
About 2 minutes. I started CPR right away.
Did you deliver a shot?
So we did deliver one and then walked directly to the breath.
Back up.
Take the victim for analysis.
No shot is fine.
Wait, he just moved. We've got to organize with him.
I have a pulse.
He's breathing.
Let's move him.
Get the stretcher. You're coming close to the hospital.
Okay. He's just.
First, let's talk about the adult chain survival. There are 5 links in the chain. It starts with immediate recognition of cardiac arrest and activation of the emergency response system. Then it moves to early cardiopulmonary resuscitation, or CPR, with an emphasis on chest compression. After that, rapid defibrillation. The next link in the chain is effective advanced life support that leads finally to integrated post-cardiac arrest.
There are 5 differences in these links if you're inside the hospital. The first link is surveillance and prevention of cardiac arrest, with patient monitoring and assessment by the medical emergency team or rapid response team when the patient's condition is starting to deteriorate. The next link is early activation of the code team, followed by early CPR, early defibrillation, and post-cardiac arrest care. Post-cardiac arrest care may be provided in the cath lab and ICU. And this chain is really a useful metaphor to understand the connection and flow between the stages of emergency cardiovascular care. We just witnessed the chain of survival in action with the victims seamlessly treated. So now, let's go back and review the links in the chain of survival as they happen.
It's a normal day at the airport. You see the man's wife notices he's not looking well. After he collapses, she immediately calls for help. A security guard rushes over to help. The guard gets no response or sign of breathing, so he directs a coworker to activate the emergency response system. The chain of survival begins right here, with the guard's immediate recognition of possible cardiac arrest and activation of the emergency response system.
A rescuer must recognize that the victim is in cardiac arrest based on unresponsiveness and lack of normal breathing. After recognition, the rescuer should ensure that the emergency response system has been activated and begin high-quality CPR. Effective bystander CPR provided immediately after cardiac arrest to double or triple a victim's chance of survival. Bystanders who are not trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult suddenly collapse, there are 2 simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers may provide further instructions and guide the bystander until trained help arrives. Some healthcare providers might find it necessary to provide compression-only CPR until a barrier device is available.
The guard immediately begins chest compressions without delay.
The second guard returns with the AED. This introduces the next link in the chain of survival. The AED, or automated external defibrillator, is a lightweight portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal. Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly when the victim loses consciousness. Death usually follows unless the normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, light, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing layperson and healthcare providers to attempt defibrillation safely. As the EMS providers arrive and take over care, they extend the chain to give the victim the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment to the victim. Once the return of spontaneous circulation or ROS is achieved, the victim is transported to receive post-cardiac arrest care. Post-cardiac arrest care after ROS focuses on preventing the return of cardiac arrest and on interventions that can include long all ages and practice delivery of these skills both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review the rescue again, pointing out the steps of basic life support as they happen.
You can see the guard scan the scene to assess safety in the terminal, even alerting another officer on his radio. First, he tries to get the victim to respond. Then, he checks the man for breathing by watching his chest rise and fall. He sees no sign of breathing.
Although the guard detects no breathing here, abnormal breaths are common in the first minutes of cardiac arrest. These abnormal breaths are called vaginal gas and should not be confused with normal breathing. Rescuers can sometimes mistake vaginal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR.
As a lay rescuer, the guard does not check a pulse. Lay rescuers should not check a pulse and should assume that cardiac arrest is present if an adult suddenly collapses or an unresponsive victim is not breathing normally.
We see the guard start CPR by removing the victim's shirt and giving chest compression. You can see that he places the heel of one hand on the center of the chest, just over the lower half of the breastbone. Then, he places the heel of his other on top of the first, and he keeps his shoulders right over his hands for leverage, with his elbows straight.
The critical characteristics of adult high-quality CPR are to push hard and fast at a compression rate of 100 to 120 per minute and a depth of at least 2 inches or 5 centimeters. Allow complete chest recoil after each compression and minimize interruptions with compressions to less than 10 seconds. There is some evidence that compressions that are too deep, more than 2.4 inches or 6 centimeters, can increase injuries from CPR. However, most providers do not perform compressions deep enough. You should focus on making sure your compressions are at least 2 inches or 5 centimeters deep. We recommend the use of ensure that the compressions are the correct depth. We'll talk about CPR.
And as you can see, giving compressions requires intense effort. You'll discover this in a few minutes when we practice chest compression. After the second guard returns to the AED and kick, she first turns on the AED. She then removes the adhesive backing and attaches the pads according to the diagram.
When the compressions are given throughout the process, blood flow into the victim's heart and brain. Once the AED is powered on, it will give audible prompts on what action to take.
Right here, the AED prompts responders to stop compression while it analyzes the victim's heart rhythm. It takes just a moment for the AED to advise that a shock is needed. The second guard makes sure nobody touches the victim so that the electrical current from the AED doesn't transfer to someone else. And then she delivers the shock.
Once the shock is delivered, most AEDs will give a prompt to resume compression, but it doesn't.
The guard initially provided compression without ventilation because he did not have immediate access to a barrier device such as a pocket mask. Once the AED that included a pocket mask arrived, the guard was able to provide compression and ventilation while the second rescuer used the AED.
The EMS team has arrived to take over. They use good team dynamics by asking the guard to summarize the history of events and care provided.
The EMS team assesses the victim and confirms that he is still in cardiac arrest, so they resume CPR. Now, ventilations are provided using a bag mask device.
The EMS team attaches their manual defibrillator to the victim. The device used by this team can be set in manual or AED mode. Use of the defibrillator in the manual mode requires advanced training to operate that we won't be covering in this course. In this scenario, the defibrillator is set to AED mode.
The AED advises that no shock is required, and the victim begins to move and breathe. The EMS team identifies an organized rhythm and a pulse.
It's worth mentioning that there are many ways that this scenario could have been different. This scenario shows how an integrated system of care helps to achieve a positive outcome, from the bystander recognizing the problem and getting help, to the lay responder initiating care, to the EMS team arriving, stabilizing, and transporting the victim to the hospital for post-cardiac arrest care.
You never know what situation you'll face or what resources will be accessible. But our goal is that with today's training, you'll have the knowledge and the framework to provide high-quality, life-saving CPR, regardless of the conditions and circumstances.
To begin training, will focus on individual skills that rescuers perform. It's most effective to perform CPR as a team. However, to be an effective team member, you'll need to possess the individual skills of CPR. So we'll start.
As a healthcare provider, your first step is to assess the surroundings for safety. Then tap and shout to determine responsiveness. If there is no response, you should shout for nearby help or activate the emergency response system in your workplace. Check for breathing by scanning the victim's chest, looking for chest throbs. Check a carotid pulse. The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you, the rescuer. Locate the victim's trachea by using 2 or 3 fingers and then slide your fingers into the groove just to one side of the trachea where you can feel the carotid pulse. You can scan for breathing and check a pulse simultaneously to minimize time before first compression. The check for breathing and pulse should take at least 5 but no more than 10 seconds. If you observe no breathing, abnormal breathing, or only gasping, and you do not definitely feel a pulse, ensure that help is on the way and start chest compressions immediately. In this practice session, you will first check for scene safety. When the scene is safe, approach the victim and tap and shout to determine responsiveness. If the victim does not respond, yell for nearby help and check for breathing and a pulse. If there is no breathing or only gasping and no pulse, ensure that help and an AED are on the way and immediately begin CPR, starting with chest compressions.
We'll pause here before we practice checking for scene safety, responsiveness, breathing, and pulse. So position yourself to the side of your mannequin to practice. The instructor can begin.
Now we'll see a scenario with rescuers from multiple agencies.
The real challenge in situations like this becomes about logistics. In other words, the coordination of rescuers and resources when more people are involved. Dispatch, this is Engine 1. We're on the scene. Copy that, Engine 1. Time is 14:55. Dispatch, we had one vehicle upright, no signs of damage, no hazards noted. We have 2 victims present, one is still in the vehicle. Engine 1, one vehicle upright, no hazards noted, 2 victims total, one still in the vehicle.
What'd you think, Chris? Hey, Rex, can you hear me? No response?
What happened?
We were driving, my dad started having chest pains and we told him to get, and he just now passed out. No breathing. No pulse.
This is cardiac, not trauma. He needs CPR right away. Alert the medics that we have a cardiac arrest and get the AED. Got it? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Attached path to patient's bare chest.
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, Jacob, you're ready to rotate in for compression. 1, 2, 3, 4, 5, 6, 7, 28, 29, 30. Clear, clear, clear.
Shock needed. Charging.
1, 2, 3, 4, 5,
Stay
6,
clear of
7,
patient.
8.
Deliver shock now.
Clear.
Shock delivered.
1, 2,
Resume
3,
CPR. Start with
7,
compressions.
8, 9, 10, 11, 12. Who we got? Victim in cardiac arrest when we arrived. No sign of trauma. The doctor says he was having chest pains and went unconscious just before we arrived. We shocked him once and we've been at for about 3.5 minutes. Thanks. We'll put that monitor together for the next moving check. Jacob, press a little more deeply and avoid leaning. 4, 5, that's better. 10, 8, 9, 30. One, 2, 3, 4.
Analyzing heart rhythm. Do not touch
9,
the patient.
10. Clear the patient. Clear.
Shock needed. Charging.
1, 2,
Stay clear of the patient. Deliver shock now.
Revelation. Clear.
Press the flashing button now.
Shot.
Shock delivered.
1, 2, 3, 4,
Resume
5,
CPR.
6,
Start
7,
compressions.
8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3.
Good job with chest compression. Keep it up.
6, 7, 8.
We should start 9 being. Let's draw.
I just left my sweater.
Stop compression. Check the monitor. See an organized rhythm.
Let's check the pulse.
You got a pulse. Hey, Rex, can you hear me? Come on, Rex. Rex, wake up, Rex. No response.
Is he breathing?
No, I'll continue bagging.
Remember to get one breath every 5 to 6 seconds. I'll start 9 being. Let's get his blood pressure. How easy is he to bag?
His ventilation's good.
Let's get ready to transport.
Let's watch this scene again, paying special attention to the use of the AED and providing breath by using the back mask device. When the team members arrive, they assess the scene and try to get a response from the victim. The emergency responder takes a few seconds to check for breathing, looking for no breathing or only gasping, and at the same time, attempts to feel for a pulse. Finding no breathing and no pulse, the team alerts the paramedics en route that this is cardiac arrest. The team moves the patient to a hard, flat surface to begin CPR. One rescuer starts compressions while the second delivers ventilation. A third rescuer sets up the AED and begins attaching the pads to the patient.
During compressions, the compressor counts to 30 so that 2 breaths can be given after each set. The AED is attached and signals that it's ready to analyze. This provides an opportunity for the compressor to switch. We need to point out that it's important to know your AED or defibrillator because there are different models, and it's also important to follow your device's prompts. You may have noticed that the compressor took advantage of the time the device was charging to deliver a few crucial compressions.
High-quality CPR and rapid defibrillation are priorities. The emergency responder operating the AED is responsible for clearing all rescuers to allow for rhythm analysis. If a shock is advised, the emergency responder again clears everyone and delivers the shock.
As soon as a shock is delivered, another set of compressions begins with a different rescuer delivering compressions and using a feedback device. Feedback devices can monitor CPR quality regarding rate, depth, and chest recoil, and provide real-time corrective feedback to rescuers. After each set of 30 compressions, the emergency responder delivers 2 breaths, ensuring that the chest rises with each breath.
The paramedic team has arrived. Now, the team leader directs the handoff with acting instruction in CPR by providing the summary of events.
Releasing.
Now let's focus on the use of the AED. You'll need to take a moment to familiarize yourself with the type of AED device used in the training class today. Although AEDs may differ slightly, there are 4 universal steps for operation. To begin, turn on the AED. Just open the carrying case or the top of the unit and simply power on the AED. Some devices will power on automatically when you open the lid. After that, attach the pads to the victim's chest by using the diagram of the pads on the correct placement. Some AEDs may have adult and pediatric pads. Be sure to use the adult pads on anyone 8 years of age or older. If you're not sure of the victim's age, use the adult pads. You may also need to plug in the pads for certain models.
Following the pictures found on the pads, attach the adhesive pads to the victim's bare chest. Place one pad to the side of the left nipple and the other on the victim's upper right chest, directly below the collarbone.
After the AED is turned on, some units will tell you to press a button for the device to analyze the heart rhythm. Others will analyze the rhythm automatically. The AED may take about 5 to 15 seconds to analyze the rhythm.
The AED will deliver an audible prompt when it's ready to analyze the victim's rhythm, followed by a prompt to clear the victim. The rescuer should strongly repeat the command to clear, checking visually to be sure that all rescuers and people receive the command. Once the AED completes its analysis, if a shock is advised, it will charge and then prompt again to clear the victim. The rescuer should again repeat the command to those nearby. Loudly state something like, "Everybody clear?" or simply, "Clear." And visually make sure that nobody is touching the victim, not even the person in charge of giving breath. Then, the shock can be delivered. Next, press the shock button. The shock may produce a sudden contraction in the victim's muscles. After the AED gives the shock, resume CPR immediately, beginning with chest compressions. Do not remove the AED or turn it off. The device will repeat the analyzing shock cycle about every 2 minutes. Follow the voice prompts of the AED. If at any time the AED indicates no shock is advised, immediately start chest compressions.
You'll need to consider a few special situations when using an AED. First, if the victim has hair on his chest, the hair may prevent the pads from sticking. If your AED has only one set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has 2 sets of adult pads, you can apply one set to the hairy chest. If the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then reapply a new set of the pads to the bare skin.
Water on the victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart.
If someone is lying in water, you should quickly move the victim to a dry area. However, if the victim is lying on snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pad. But wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pad. These devices look like a round or square lump, smaller than a deck of cards. If you see this lump, avoid putting the pad directly over it.
Also, do not place the pad directly over a medicine patch. If the medicine patch is located where you need to place the pad, take the patch off and quickly wipe the chest before you put on the pad. If your workplace has an AED, you should familiarize yourself with that model. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. Additional emergency equipment may also be found in the AED, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with an AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on the victim.
Sometimes a cardiac arrest can occur where treatment is delayed, either because of barriers to accessing the patient or the arrest not being witnessed. Regardless, CPR is still critical.
The earlier a victim of cardiac arrest receives CPR and shock delivery, the greater his or her chance of survival and recovery. And early CPR has been shown to double or even triple survival from witness sudden cardiac arrest.
So let's take a look at an instance where CPR was delayed.
Ready for lunch?
I'm not feeling well at all.
What's the matter?
I'm feeling like my stomach is upset. Just really lousy. And they've been coming down with something.
Let me get you some water.
Yeah, I could really. Oh, I need to head to the bathroom.
You gonna be okay?
Yeah, I think I overdid it with the gardening this morning. I'll be fine after I wash up.
Sam, you alright? Sam, you've been in there for a long time. Sam, are you okay? Oh, call 911.
Medic to respond, medical emergency, 1105 Country Road 59, unconscious male.
Medic to responding.
Medic 2, no other units available for backup. We will dispatch another unit when available.
Thank goodness, he's inside. The dispatcher asked me to do CPR, but I couldn't do it.
What happened now?
And he wasn't feeling well. He said it was just his stomach. So he was in the bathroom for a while. Sam.
I didn't say there was no help.
Maybe before lunch, and he went in to wash up in the bathroom.
How long has it been since you found him there?
I don't know, 10 minutes, and I was worried about him. I checked on him, and he wouldn't respond to me, so I dialed 911. But he's in here, to the left.
Hey, Sam, are you okay? No response. He's not breathing. I can't get a pulse. Let's move to the other room. Let's start CPR.
Attach pads to patient's bare chest. Plug in pads connector. Analyzing heart rhythm. Do not touch the patient.
For the patient, clear.
Clear.
No shock advised.
Resume compressions.
1, 2, 3, 4, 5.
Switch compressors with the next rhythm check.
Analyzing heart rhythm. Do not touch the patient.
For the patient,
Okay.
No shock advised.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3. All right, let's recap. We have an unwitnessed cardiac arrest. We've been at CPR for 10 minutes. We've had no shockable heart rhythm at any time. Is there anything else we haven't done? All right, I'll go ahead and contact our open control and let you know the patient status and wait further instructions. Until then, let's continue high quality CPR.
So you could see there that the series of events guided the two rescuer teams providing high-quality CPR. And then their two rescuer actions provided crucial minutes of quality care until advanced life support arrived.
Actually, for many healthcare providers and other rescuers, the two-person or team rescue is a more common occurrence. So let's first look at the roles for two-person rescues.
The first rescuer should begin CPR with chest compressions while counting out loud and delivering breaths. They basically treat the situation at first as a one rescuer scenario. And the second rescuer is responsible for powering up the AED and attaching the pads.
Now let's review some of the points for two rescuer BLS.
Rescuers should pause compression and deep breath until an advanced airway is in place. And if you're performing CPR without an AED, rescuers should switch roles when fatigued or after every 5 cycles. That's about 2 minutes. When an AED is present, switch roles every time the AED tells you to reanalyze. The switch should take less than 5 seconds to minimize interruptions in chest compression.
The rescuer giving breath should monitor compression rate and depth, watch for complete chest recoil, and give feedback to the compressing rescuer regarding proper technique.
So now you'll be practicing and working as part of a two-rescuer team. For most healthcare providers and other rescuers, a two-person or team rescue is far more common. In two-rescuer CPR, each rescuer has a specific role. Let's review these roles while watching them play out.
Rescuer number 1 should be positioned at the victim's side, ready to perform chest compression and count them out loud.
And rescuer number 2 should be positioned at the victim's head. It's rescuer 2's role to maintain an open airway and give breath with a bag mask device while watching for chest rise and avoiding excessive ventilation. Rescuer 2 should also encourage rescuer 1 to perform chest compressions that are fast and deep enough and allow complete chest recoil between compressions.
until advanced medical help arrives. It's a wonderful thing to see teamwork move so smoothly.
That collaboration is partly due to the staff knowing BLS and their responsibilities and to them communicating well. It's also due to a team leader giving directions clearly. Successful team dynamics are critical during a resuscitation attempt. The interaction among team members has a profound impact on the effectiveness of each individual's performance as well as the patient's survival. The better you work as a team, the better the potential outcome for your patient. That's why it's so important to understand not just what to do in a resuscitation attempt, but how to communicate and perform as an effective team, regardless of your role as team member or team leader. To appreciate good team dynamics, it helps to understand what happens when team dynamics fail. Let's watch the following example of poor team dynamics and see if you can spot the areas that need improvement.
4, 5, 6, 7, 8, 9, 10, 11, 12.
We've got a unique employee, full arrest here.
Watch out, watch out. Move them over. Stop, stop. Let's start the clock. All right.
Move on 3, ready? 1, 2, 3.
When we got there, he just said he wasn't feeling very good.
Let's go ahead and look at the monitor. We need to ventilate.
He already got him twice, once about a minute ago. He should get an IV straight.
Have you stopped them?
Yeah, less than a minute ago.
Okay, take a look at the breath.
Okay, I'm fine. I'm fine.
I got it.
Teams, we need to do continual compressions with the breath.
No, 30 and 2. What have you done with my shot?
Just basic life support.
Laura, can you take care of that ID? Okay. Who's documenting? Ayla.
I'll get on it.
The scenario you just watched presented some serious communication flaws, the kind of flaws that can derail a resuscitation attempt. Successful teams not only have medical expertise and mastery of resuscitation skills, they also practice good communication skills and adhere to the key elements of effective team dynamics. These elements help teams work together in the most efficient way possible. The American Heart Association has grouped the elements of team dynamics into 3 categories: roles, what to communicate, and how to communicate. Let's review those now, starting with roles. Clear roles and responsibilities should be immediately established. When all team members know their jobs and responsibilities during a resuscitation attempt, the team functions smoothly. The designated team leader should clearly define and delegate tasks according to each team member's area of competence. Every member on the team should know his or her limitations, and the team leader should be aware of them. Team members should ask for assistance and advice early, not when the situation deteriorates. Sometimes a team member or team leader may need to correct actions that are incorrect or inappropriate. It's important to be tactful, especially if you have to correct a colleague before he or she makes a mistake, whether it's a drug, dose, or intervention. The next category is what to communicate. Knowledge sharing is a critical component of effective team performance. Team leaders should ask for good ideas for management and frequently ask for observations from team members about possible oversight. Summarizing information out loud is a good way to maintain an ongoing record of treatment and acts as a way to reevaluate the patient's status, the interventions performed, and the team's progress in the algorithm of care. This technique can also help to manage the patient's changing condition. The last category of team dynamics is how to communicate. Close communication is important for both the team leader and team members. When the team leader gives an order, the team member should confirm that he or she heard and understood the order. The team leader should call people by their names and, if possible, make eye contact to ensure that the team member has
Yeah, but
understood
in the
the
other
order
schools, I
before
think you have
additional
options
tasks.
but
The
Sam
team
Ray
member
looking
should
at.
tell the team leader when he or she has completed the intervention. Team leaders and members should also use
Hey,
clear
let me
messaging.
finish this right here. I'll play back in just a couple minutes,
Clear
okay?
language helps prevent
Let me keep
misunderstandings.
my-
Speaking in a tone of voice that is loud enough to understand, but also calm and confident, helps keep all team members focused on the task at hand. All team members should display mutual respect and a professional attitude to other team members, regardless of their personal expertise or training. Because emotions can run high during a resuscitation attempt, it's especially important that the team leader speaks in a friendly, controlled voice and avoids shouting or aggression. Not only is it important to know what to do during a cardiac arrest, but it's just as important to know how to work together as a team during an event. Debriefing as a team is an important component of every resuscitation attempt. Such debriefing during and after an attempt helps individual team members perform better, and it may also bring system strengths and deficiencies to light. Implementation of debriefing programs may even improve patient survival after cardiac arrest. Now we'll see the same scenario with everyone using good team dynamics. See if you can spot each key element in each.
Everyone surprised this time. Units called in that they have a 16-year-old male who left his unit as they were arriving. They're unloading now, and is moving into the car. Still ventilated when they arrive. James and Aaron, you provide the perception test for the first round. James, your first one compressions, and Aaron, I need you to hook them up to our monitors and details. Yeah, I'll start my compressions.
And I'll have monitors.
Okay, good, thanks. Laura, can you take IV and meds?
Yes, I'll think I'll be enough.
Kayla, I need you to report.
I'll record.
Great.
Hi, I'm the BLS crew. This is a 2-year-old male here with his cardiac arrest. Besides the let's go. We started compression, applied our AED, did 1 shock with no rush. We then did a second shock at the 2-minute mark with no change that we could see. He has been using back.
Okay, thank you. Let's move them over at 30. 28, 29, 30. What? 1, 2, 3.
Mike, I'll take over compression.
Thank you. Good switch. James and Aaron, you can swap out compressions every 2 minutes or sooner if you get tired. We have an ID? Laura, if you can't get the next hit, try an eye up.
I'm recording.
Hold compression. Do not feel a pulse. He's in PEA. Continue CPR.
Yeah, I did it.
Good.
Then please provide continuous compressions and I'll give a breath every 8 seconds.
Are you sure? I think it's 32 so advanced airway. You're right. Good catch there. Continue 30 compressions with 2 breaths for now. Kayla, can you provide a summary of the action so far?
We've inserted an IV and a
As you just seen, designating team roles and good communication allows for a rapid and orderly response in an emergency situation. Clear direction and effective communication by all team members creates an environment where patients have the best chance of survival. The ideal situation is a team with multiple rescuers to perform all needed roles in a resuscitation attempt. This figure identifies 6 possible team roles for a resuscitation.